Joining us now, former House of Delegates member, one of my favorite members, Chris Peace, and he fought hard for getting horse racing back in New Kent with Colonial Downs, created thousands of jobs there, then Rosie's. But now, horse racing is supposed to start in July. It's June 4th. No one knows what's going to happen. What's the governor going to do? Jobs are at stake. Are we going to get the horses? What's happening? No one knows. But I guess you can't go to the racetrack, Chris, but if you want to protest in groups of 1,000, oh, that's okay. But you can't go to the track. Whatever. Good to have you with us, Chris.
Thank you, John. It's great to be with you as always.
Now that you come on, before we get to health care, I'm not very happy about the fact that I can't go to the track in July like I'm supposed to. Like, now what, right? We finally get it back 1 year, and like, now what? Now it's going to be closed again? Do you have any idea what's going on there?
I would love to say I had all the answers for all the world's problems, including the horse tracks being closed, but I have faith that we will get those reopened, much like we're reopening Virginia's businesses. I actually had a conversation with one of the board members in New Kent, and the local leadership obviously is very interested in getting the track back open because it's a major part of revenue for the county, which supports teachers, education, other core services, and they're going to be taking some steps to, petition the governor to ensure that their voice is heard, and that issue is on the table for consideration as these phased reopenings evolve throughout the summer. So we have the best hopes for a fully reopened Virginia in the near future.
I mean, what is the reason to keep Virginia and businesses closed when thousands of people are allowed to gather and protest around the state? Hampton Roads, Richmond, Northern Virginia. I mean, thousands of people can gather without masks and gloves, and they can protest, but I can't go to a restaurant or put a towel on the beach. Can you try to explain the logic behind that, Chris?
Man, that is more than $1 million question, John, and I wish I had the answer to it. But, working with the Virginia Consumer Health Care Alliance, our focus is obviously on people's health and access to quality care at affordable cost to try to hold big insurance accountable. As you know, we were successful in presenting information to the public that led to legislative change on surprise balance billing. I was part of expanding access to health care to 400,000 Virginians with Medicaid expansion. And throughout this pandemic, the Healthcare Alliance has put out information regarding, remaining safe, taking the precautions, the common sense steps that we all agree on, and really supporting our frontline workers, the healthcare workers that are out there trying to keep people safe every day.
All right, we are with former Virginia House of Delegates member Chris Peace. If you don't know, Chris is co-chair of the Virginia Consumer Healthcare Alliance. He's been on the show many times, as you know, to discuss putting an end to balance billing, which is stupid, and other healthcare issues. Hate to be blunt, Chris, but now's the time for that. Now, I'm going to be talking to Chris a little bit about another thing we have in common, a desire to see the return to normalcy for the economy, which, just like you can't get to normalcy until you get people back to work and going outside and everything else. Now, look, Chris, over the past couple of weeks, I've been traveling all over the country in my Open America tour in support of reopening America's businesses to restore our economy, to restore the dignity of employment. Personally, I think part of the fact that we're having this problem with these protests and riots right now is that people have been pent up. They're out of work. They don't have anything to do. They're out of school. I want the employment of millions of people to come back. They've been sidelined. We have got to get this economy going again. We have to have the ability to do it in a responsible way. Governor Northam, I've been his biggest critic. The slow-rolling process in Virginia. I mean, if you read the Phase 2, it's a joke. You can't even follow it. I mean, the whole thing is stupid. I'm trying to shine a light on the harm of what this governor is doing to businesses. But today we need to talk about the Northam administration holding up the release. Get this. Just when you think it can't get worse, it does. Holding up the release of taxpayer funds approved by Congress and signed by the president to help healthcare providers and other essential segments of the economy. just when you thought he can't get worse, why is he holding up funds meant for the healthcare industry that has already been approved by Congress and signed by Trump? What is the deal with this guy?
Well, John, we have a healthcare crisis, an economic crisis, a social crisis all going on at the same time. And the Alliance is hoping to provide information to citizens about this issue that you've highlighted, to hold our elected officials accountable and to direct taxpayer funds to where they were intended. I mean, just basic accountability. As you and your listeners may know, Congress did pass several economic stimulus bills worth trillions of dollars. Whether you support that, it was done. But now we have $6 billion in stimulus coming to Virginia, and over $3 billion of that has come to Virginia for specific relief, coronavirus aid, relief, and security act. That's through the CARES Act. Most people are more familiar with that acronym. And the CARES Act is very specific about how the money's to be spent. It's supposed to be for community health centers out in, our neck of the woods, mental health and substance abuse services. As you know, during this pandemic, there's been increases in opiate addiction and suicide rates have gone up. So we want people to be able to have access to services. Nursing homes certainly have been in the news during this pandemic. Much of this money is to go to nursing homes, rural hospitals, services for the elderly, education, transportation, and much more. So what we want to see is that these dollars that have already been approved, that are being directed to Virginia, and directed to Virginia to help very specific areas in our economy and for people, that these funds be released and allocated for their very intended purpose. And that's what our goal is, to get this information out. We want people to be able to contact the governor's office to make sure that these funds hit the streets to where they were intended by Congress.
Well, what's the holdup?
Well, I wish I had the answer to that, John. We're going to hopefully release it with the public support, and we want to get that information out there. Congress gave instructions on how it should be spent, and now it's the time. So
I mean,
it remains to be seen.
Have you specifically talked to Clark Mercer, the chief of staff of the governor's office, as to what the holdup is? Do they have an answer, or are they just incompetent, or they don't want to do it, or they can't figure it out because 5 plus 5 they don't have an abacus? I mean, why is this money held up? What is their possible reason now?
Well, I can't speak for them. I just want to get the information out so that people can contact the governor's office, so that we can remind them this is a priority. I know that they've got a lot on their plate right now with the 3 crises that I named. But people recognize that our doctors and nurses, the first responders, these are the real heroes of the pandemic. And, the frontline caregivers in these areas I referenced need new gear and ventilators, and they need to add patient beds. They want to invest in their operations fully, and it's expensive. And these dollars that are directed by Congress will help any of that lost revenue that has been expended during this pandemic that has been used to, really protect the public health. So we don't use those funds now to soften the blow. We might lose providers. So, we've been fighting for greater access to care. And, if we don't use these funds the way they were intended, we might lose some of the providers that actually provide that access to care. So we don't need to take 2 steps backwards as we're taking 1 step forward in healthcare reform over the last 2 years.
The incompetence of this administration is beyond the pale. Between policies that make no sense, between everything this governor does, and now just the raw incompetence of not getting these funds out that has been passed through. They have the money sitting in some wire fund someplace. I mean, just disperse the money. I mean, you have an entire administration of people, most of them sitting at home working in their pajamas till noon. I mean, I tell you what, Chris Peace, I don't know how we can go on this way, right? Day after day, we get the same nonsense from this governor's office. I mean, now they're worried about taking statues down. Fine, take the statues down. Just release the money to the healthcare industry that has been provided to you by the federal government. Why is this so hard? Why is this so difficult to do? Why? You have to start asking yourself these questions. I mean, what if our frontline healthcare workers, Chris, let me just ask you this. What if our frontline healthcare, our hospital workers, all of the people that have been there for us, all the hospitals that have been there, the doctors, the nurses, the first responders. What if they took the same attitude the governor has? Well, I'll get around to it. Well, I'll get around to picking you up in an ambulance when I get my Chinese food delivered. I mean, what if they took that attitude, Chris? What would happen? This is outrageous.
There's been a lot of lip service about how we support our heroes by a lot of people in the community. But, this is time to put your money where your mouth is. I mean, frankly, and if we don't support these providers on the front lines, they may go away. As you described, and we can't afford that. That will be completely injurious to access.
Yeah, but meantime, if you work for the Northam administration, here's the deal: you get paid the 1st and the 15th of the month. We pay your salary. We're taxpayers. Money gets wired into your account. You got all your health insurance taken care of. You can sit home in your pajamas till noon. You can do Zoom. You can put on your robe. You don't have to come into work. I mean, give me a break. Let's get this money out. We got $3 billion in federal stimulus funds. This is taxpayer money that was given to the Virginia health workers. Congress gave explicit instructions on how it should be spent, and the governor and his administration, they're trying to get cute about how to divvy up the money. This is about politics now. Once again, this incompetent governor and his incompetent staff, all they're driven by is some nonsensical political agenda. This money is clear. It's $3 billion. It's for the healthcare administration. It's very targeted. That's it. Now they're spending time on Zoom deciding how they're going to divvy up the money. That's what I've heard. You know what? What do we have to do? How long can we let this incompetence in this administration go on?
Well, that's the real question is, now's the time for action. We need to get this money to the street where it's intended. That will help the economy tremendously. It'll help the front line, the providers that we've all been supporting throughout the pandemic. So if there are folks that join you in your frustration on this issue, they can contact the governor's office. And here's the number, 804-786-2211, 804-786-2211. We need to get the federal relief to the nursing homes and the hospitals and the health centers on the COVID-19 front lines. So I'm asking people to join with you, John, and join with us in the Alliance and contact the governor so this $3 billion can hit the streets immediately. It's time to act.
804-786-2201. Pick up the phone and call the incompetent governor's office and tell them you want this money delivered like it was earmarked for, and stop playing games with it. 804-786-2201. And you know what?
2211. 2211, John.
2211. I'm sorry. Let's say that. 804-786-2211. I wish you were in the House of Delegates because you get this stuff and you'd be railing for it. I haven't heard a peep on anybody. It's just so frustrating. All right, so what's at stake here? Chris, bottom line this, how is this going to impact our healthcare system? By the way, we're with Chris Peace, former House of Delegates member, New Kent, Virginia Republican, and he's now co-chair of the Virginia Consumer Healthcare Alliance. Great guy. Look, I wish you were still in the House because you'd be on the phone getting this done, but you're not, so we can only do what we can do. But how does this impact us now?
Yeah, well, John, one, thank you for giving us the opportunity and the platform to get the information out. The Virginia Consumer Healthcare Alliance, we're bipartisan. We want good government. This is a taxpayer watchdog issue, and you are a watchdog, John, and I'm glad that you can join us in this. $3 billion will do a lot of good when it hits the streets in the areas to which it was intended. The providers that are on the front lines, the nursing homes, the healthcare workers, $3 billion will help the economy. And we need to support those on the front line. Congress intended it for these purposes, and we need to make sure it gets there post-haste right away. Now's the time to act.
So the way we act is by picking up the phone. This really infuriates me because this money was earmarked by Congress and signed by the president for a specific reason. And now we have the Northam administration playing political games with it, trying to appease, different constituencies that they have. I mean, it's unbelievable. Unbelievable. Hey, why don't they stop worrying about taking statues down for a day? And why don't they do two things? Call the National Guard so our stores are not burned down, and release the $3 billion in federal stimulus funds that are very clear. I mean, this isn't like, here's $3 billion to help you guys out, decide what to do with it, right? I mean, Chris, let's be clear. This is not a fund, put the money where you think it can best help Virginia. This money is targeted, right? It got passed by Congress. It is targeted for specific reasons. Oh, there isn't any debate on how to divvy it up. It goes to where it goes. That's why it was allocated.
Well, John, thank you for giving us the opportunity. It is frustrating, but if it gets released today, all's well that ends well. We want to make it happen. We want people to join us in this voice and call on the governor.
Clark Mercer, you listen to my show. I'm really getting aggravated with this $3 billion. Go in the governor's office today. Get this money distributed into the healthcare system as it was targeted to be, right? It'll take you 5 minutes. Go to the governor, knock off the games, get this done. Hey, Chris, great info. This is a real taxpayer watchdog issue. I'm glad you brought it to our attention. I encourage, again, our listeners, call the governor, 804-786-2211, 804-786-2211. Tell them to release these funds to help our healthcare heroes, and simply give the money for what it was earmarked to do. It's a pretty simple math here. Chris Peace, always good to have you, man. Always good to have you.
Great to be with you, John. I hope to see you in person someday soon.